In late 2022, Uganda experienced an outbreak of the Sudan Ebola virus. Through a combination of improved testing, surveillance, contact tracing, supportive clinical care, and community participation, the Ministry of Health declared the outbreak over. However, this was not the end of the road for the survivors.
People get sick, and the outcome is some die, some survive. In this Ebola response, we had 87 survivors. Our knowledge on especially Ebola Sudan is limited. So we are conducting a number of investigations about the disease.
The Survivors Programme has been an excellent one. This is the very first time we're having such a program on board.
Provide and respond to the needs of people that have survived Ebola. We all know that Ebola is a high fatality infection, and having people survive it is also one of the key things that we see as a benefit.
Some of your survivors, although they do not have the disease, still have the virus within their body and they can't transmit it. So you have to monitor and ensure that they are not infective anymore.
In the Entebbe Regional Referral Hospital Survivor Clinic, we offer quite a range of services, ranging from clinical reviews that are done on a monthly basis for the first 1 year of the program. With the support of WHO and European Union, the Ministry of Health managed to come up with guidelines and schedule for the visits that the survivors have to make to the Survivor Clinic.
Part of the activities that we do in the Ebola Survivors Clinic are providing for the social well-being of the survivors, but then also attending to the medical needs.
These include clinical care, include laboratory testing, include breast milk testing, semen testing, safer sex counseling, as well as the mental health and psychosocial kind of support that they need.
The survivors have gone through a very difficult ordeal. They are so psychologically traumatized from being ill.
When a survivor's appointment is due, the survivor is called ahead of time. When they come to the clinic, they are registered. Their vitals in terms of temperature, blood pressure, pulse rate taken. Then they are sent to the doctor's room for clinical review, where we use quite a number of forms that were developed to manage data from the survivor clinic. Then they go through mental health and psychosocial support reviews, after which a decision is made to either take them to the laboratory and do some tests or not. Then after which drugs can be given in case they need any medications from the different reviews that have been conducted.
Sometimes we have to go to the LCs and whatever, we ask them what they think about these people, how they feel the community is treating them.
In the society, they are sometimes stigmatized, and they might continue to be stigmatized. So you want to handle that stigma.
When you have a program for them, they can have an opportunity to speak out and share their views.
Waliwo emizindaalo egiri mu town. Oli ayimirira ku kizindaalo n'agamba abo babawadde emyaka 2 biki kati nga muli bw'okiwulira owulira ddala muntu mukyamu ddala ate obigamba era abasawo ne bajja ne basooka bakolayo meeting bagamba abasavaiva temubalangira kubanga olwedde mwe mulina obayamba kati bwe munaabalangira bagenda kunoonya obuyambi gye babujja olusiba ekyawe n'okwekyawa tebaanaba kutereera muli mu birowoozo mwe mulina okubabuddabudda ne banyonyola abantu awo ne babanga abakola ki ng'abadda mu mbeera.
The support is not only medical but also psychological and social. Some of them have their house items burned to ensure that there is no infection. So you have to also support them in their well-being and social life.
To demonstrate that as a country we are focused on supporting the survivors, we've come up with guidelines for the care of survivors of the Ebola virus disease in the country, and this will be a document to provide guidance unto the rest of the healthcare providers in the country.
Survivors are assets. So we would keep contacts. We would like to have survivor groups interact with us, with the government, so that we learn from them as well. I would like to appreciate the European Union ECHO program, their support for the survival program, which enables us to ensure this, we have an optimal support for the survivors, but also ensuring that we learn from this experience so that our scientific knowledge is advanced